Hey, Dr. Mendel again. We are going to go over the circulatory system for the neck and inside the cranium as far as the arteries are concerned. I'll do another video with some torsos. So what we're looking at here is we're going to be looking at the blood supply to the neck, head, and the brain. So when you start, there's 4 major vessels that's going to be supplying blood to the brain. And so at the bottom here we see the common carotid artery on the left, the common carotid artery on the right, the vertebral artery here. So we see the vertebral artery goes up through the transverse foramen and the cervical spine, and it dives back into and enters into the foramen magnum. The vertebral artery is off a branch of the subclavian artery. The common carotid on the left is the same on this heart model as this vessel right here. So this is the left common carotid. So if you were thinking about how your heart connects, we have this vessel connecting to the left common carotid. On the opposite side, the right common carotid is a branch off of the brachiocephalic artery and then the right common carotid. So it connects like this. And so our heart is pumping blood to the brain through those 2 vessels. So we have the common carotid artery, which divides into the internal carotid artery and the external carotid artery. The internal carotid artery goes up and enters into the carotid canal. And I don't know if you can see that from the video or not, but it goes through the skull and enters the inside of the skull through the carotid canal. The external carotid artery has 5 branches on this model. The first of which is going to be going to your thyroid, and that's the superior thyroid artery. The second goes to your tongue, which is the lingual artery. The third one goes to the face, which is the facial artery. We have a branch going to the side of the head, which is one of the vessels you can palpate. It's a pulse point. You can palpate for pulse, called the superficial temporal artery, and there is an occipital artery. So those are the vessels on the outside. We said that the vertebral artery is going up through the foramen magnum and the internal carotid is going through the carotid canal. Let's look at those from the inside. When you look inside the cranium, we see those 2 vertebral arteries, one here and one here, going through the foramen magnum. Together they form this vessel called the basilar artery. The basilar artery comes up and joins this circular structure called the circle of Willis. If we look at the carotid canal, we can see the internal carotid artery coming out of there. It also comes up to join with the circle of Willis. So this circle of Willis has the anterior communicating artery here and the posterior communicating artery back here. Those 2 are forming the circle. Now your brain is going to want blood, specifically the cerebrum. So we have these 2 arteries, which are called the anterior cerebral arteries, giving blood to the brain. This one and this one are the 2 middle cerebral arteries going to the middle of the cerebrum. And here we have the posterior cerebral arteries. And that's it for this model.